Hello Professor, my name is Divya Sachdeva. My student ID is 1189572440. Today I'm going to perform the procedure of wound dressing, and here is the 360-degree view of my room. Hey, hi, how are you?
I'm good.
My name is Divya Sachdeva. I'm your student nurse for the day. May I know your full name?
Yeah, Sheetal Sharma.
Okay, your date of birth?
19 March 2001.
Okay, can I see your wristband for cross-checking? Okay, good to go. So Sheetal, today I'm your student nurse and I'll be performing change in the wound dressing that is prescribed by the doctor. Are you comfortable with it? Okay. My hand hygiene is done and the privacy is maintained. So Sheetal, before starting, let me ask you 2 to 3 questions. Do you have pain in the wound?
Yeah, I am.
Okay, on the level of 1 to 10, 1 being the least, 10 being the most, how can you rate your pain?
It's 5.
It's 5. Okay, do you need any medication or it is controllable?
It is controllable.
Okay, so do you have any allergies from any medication?
No.
So here I can see that the patient have 5 pain, that is the moderate level of pain. She doesn't need any medication and she's not allergic to any of the medication. So after this Sheetal, let me reposition your bed. Let me open the absorbent sheet so that it can prevent any soiling. Can you put your hand over this?
Yeah.
Okay, are you comfortable?
Yeah, I'm comfortable.
After this, I'm gonna perform my hand hygiene and I'm gonna wear my gloves. After this, I'm gonna set my sterile tray. For this, I'm removing the first flap that is away from me, the right hand side, the left hand side. Before removing the last one, let me grab my forceps and reposition the kit to create a sterile triangle. Now I'm positioning my forceps accordingly. After this, I'm putting this forceps on the edge. Now I'm pouring this saline solution for cleaning purposes. Now my tray is all set, my supplies are ready to use. After this, I'm going to remove the dressing. At any point, if you feel any pain, just do let me know. Here on this dressing, I can see the purulent discharge, which means there is a yellowish greenish discharge. It is scant in amount, not that much. The discharge is viscous and it is low. It is like moderate in consistency. After this, I can see that it is an indication that there is a bacterial growth, an infectious one. So in the real life scenario, we don't use the pad again, we just throw it. But in my scenario, I don't have another pad, so I'm keeping it aside. After this, now I'm gonna inspect the wound. The wound is present on the right arm, on the medial aspect of it, and the wound is enclosed with 6 staples. After this, let's move on to the approximation. The wound is approximated and the proximity is maintained. The edges are closed. The length, now I will measure the length of the wound. For this, I'll grab my scale and measure it. Just make sure the scale won't touch the wound. It is around 8 centimeter in length. After this, I'll check for erythema. Yes, there is little redness present all over the wound, but it is little. After this, I'll gonna start with my palpation. Sheetal, I'm gonna press your wound and just do let me know if you feel any pain at any point. Do you feel any pain?
No, I don't.
Okay. So she doesn't feel any pain. After this, I'm gonna change my gloves and I'll do my hand washing. But in this scenario, I don't have another pair of gloves, so I'm reusing these gloves. Now I'll start with putting on a new dressing. I'll grab both my forceps. I'll grab one of the swab, dipping it into saline solution, just squeezing it, and I'll clean the area from top to bottom, that is from the head end to the foot end, starting from the midline in just one single stroke and throwing it into the garbage. I'm taking another one, doing the same thing, putting into saline solution, squeezing it away, and now I'm going to clean the farthest side from me, from head end to top end, just in a single stroke. Afterwards, I'm going to take another one, dipping it into saline solution, squeezing a little. Now I'm going to clean the nearest side to me from top to bottom, just single stroke. After cleaning, now I'm pat drying the area. Now I'm pat drying the area with the gauze. Again in the same sequence, midline, just single patting. Afterwards, I'm gonna take another gauze, cleaning the farthest side, patting dry it. Towards nearest area towards me. Now the wound is totally cleaned and dry. Now I'm taking a sterile gauze and covering the area with the gauze. Afterwards, I'll put these towards the edge, and now I'm gonna secure the dressing with this sterile pad, and now I'm gonna document the date and time so that the next nurse which will come on shift can know when the dressing was last changed. Afterwards, I'll reposition the bed, making the patient comfortable. Are you comfortable?
Yeah.
Okay, so here is the call bell. If you feel any need, you can call the bell and I'll be there for you.
Okay.
Now I'll be arranging my supplies, discarding all the supplies accordingly, and afterwards I'll document the reading. So I'm done with my procedure of wound dressing. This is the 360 view of my room. Thank you, Professor.